Good afternoon, everybody. I think I know most of you. I'm Nick Azara. I'm with Manatee County Government, the County Administrator's Office. Appreciate all you guys coming out this afternoon to help us get the public the most current and accurate information that's available in Manatee County. We want to begin this meeting by reemphasizing and telling everyone that there are still no confirmed or suspected cases of Ebola in Manatee County or in Florida. There have been a number of emails and questions that have been coming in about the virus and about enterovirus. So Manatee County Emergency Management, in keeping with its role in community preparedness, decided to host a meeting with the Department of Health, local hospitals, and other medical stakeholders so that they could share and again, relate some of the most current information that's available here in Manatee County. We want to have the media availability so you guys can help us convey those messages to the public and so that you reassure everyone, again, that there are no suspected or confirmed cases in Manatee County at this time. We're going to keep the conversation fairly general this afternoon. We have several agency reps here. They'll answer some of your questions, but they won't get into detail about the protocols that are within the hospitals and local agencies. And if you have questions that we can't answer today or more detailed questions, we're going to refer you to the State Joint Information Center. It's called a JIC for short. And that number is area code 850-921-0217. Again, that's the State Joint Information Center. If there are questions we can't answer today, several of these folks will probably be referring you to the JIC, okay? Now, I'll introduce those folks behind me. Dr. Bensi, I'll give kind of a recap of what occurred at today's meeting, and then some of these other folks will brief you on the latest from their agencies. Again, Dr. Bensi here, she's the Director of the Department of Health in Manatee County. Melissa Morgan is the Director of Marketing with Blake Hospital. Vernon Nasir, Public Information Officer with Manatee Healthcare System, and Ron Coper, our Director of Public Safety. All right, guys, here's Dr. Bensi.
Thank you, Nick. Good afternoon, everyone. Thank you for being here. Just to let you know what happened this afternoon, Manatee County Government hosted an event here at the Emergency Operations Center with over 80 of our public health, hospital, first responders, and other healthcare providers today to talk about preparedness. We are very confident and comfortable that if we were to receive an Ebola patient in our community, that we would be ready to respond. Today's meeting was a general information session, first talking about Ebola in general and its epidemiology or the history of the disease. Then we're speaking also about the guidance documents that came down, any information that the first responders would need, and more detailed information such as that. And then we moved on and talked about communication and messaging and the importance of making sure through the Joint Information Center, through the governor's office, that Florida has one message as it relates to any questions that the public may have about Ebola. We went on to discuss other efforts such as response efforts if we needed those in our community, if we did have a patient, what extra response efforts would need to occur in our community to make sure that the public remains safe and that those potentially infected could be in communication with health officials to assure that if they did need treatment and that they would receive that immediately and be able to contain any type of spread of infection in the community. But at this point, really focusing on preparedness efforts with the information that we are receiving through the Florida Department of Health, which is coming from the Centers for Disease Control and Prevention and the World Health Organization.
Good afternoon. I'm Ron Coper, the Public Safety Director. As Dr. Bensi and Nick shared, today was a really good opportunity for us to come together, coordinate on our own individual efforts, given the rise of information that's coming out nationally about Ebola as well as internationally. It was a good opportunity with the CDC recommendations and the state taking a look at this. We are still operating in a monitoring mode, in an awareness mode. No changes. It's business as usual. It gave us the opportunity, though, to dig into our own areas and start preparing ourselves for if this were to elevate. We are prepared. The hospitals are prepared. Our local emergency responders are prepared. 911 is prepared, and so no changes as of yet. But we're putting together those pandemic plans. It's not unlike business that we've encountered before. We've dealt with different epidemics that have affected the world and our country, and we prepared locally just in case we were to see that here. So it was a great meeting. It was good to coordinate with everyone. No significant changes. We are following the current recommendations that are coming out of Washington and coming down from Tallahassee. We were happy to be here and meet and coordinate a little bit today. So at the awareness level, what are we doing differently or preparing differently? Nothing really. We're in the hospital business as well as in the pre-hospital business, EMS, fire departments, law enforcement. We encounter things daily that we have to use a certain level of precaution. We use universal precautions in dealing with all patients. If we were to encounter a suspected Ebola patient, we just elevate the level of precaution that we take. So instead of simply donning gloves and eye protection, we may add layers of protection on such cases. The issue with Ebola really is that if you have a suspected case, you need to isolate that person so that the rest of you don't become infected necessarily, especially your responders. And so our plans are built around that, is ensuring the safety of our responders in the hospitals. There's review, not really training, no new equipment. It's stuff that we use all the time. So there's no change in the way that we approach an Ebola patient than we would any other patient with any suspected known or unknown infectious disease. The protocol has been in place for a long time. It's not been changed, and right now we're reviewing that with folks to remind them that on every patient, it doesn't have to be a suspected Ebola patient, that you should be thinking about these things. Make sure that you have your eye protection on. Make sure that you're wearing your gloves. For the general public, the resounding message is that hand washing is a significant thing that you can do as a precaution. Hand washing, keeping your immune system up, and I'm sure Dr. Bensi would say the same thing for any infectious disease. Those are keys to prevention, and at this point, that's all we're focusing on is reviewing those basics. No tracking of anybody. I'm not sure of any local effort where we surveil movement of folks to and from different areas. So no, but in our discussions today, we talked about preparedness and how we might start tracking a patient that we become aware of, and then following up on their contacts and whatnot. So currently, no surveillance, but if we were to get our first case in the state of Florida, I'm sure the state is going to give us some guidance on how to go about doing that and finding out where that person's been and who they've been in contact with. I think that quite frankly, and Dr. Bensi can share a little bit more on this, but Ebola it's just so highly unlikely that we're going to see a case in our county. It's just a very unlikely thing. We don't want to exclude the possibility that we might see another case in our country. So the message is just be aware. Be aware that it's a possibility, and that if you follow a normal regimen of precaution, wash your hands. If you become sick, make sure that you address that. You don't let illness linger for too long. You see your doctor and whatnot. But from a public standpoint, there's nothing more that we could do now other than just being aware and getting that accurate information out to the public. We did have some airport folks here, and there's nothing currently. I think that, as I'm aware, the CDC is sending down recommendations. for if this becomes elevated. This is still a non-issue in the state of Florida and in Manatee County. So they're preparing their own processes about what to do if there were to become an elevation in our area. So currently, no further screening. Just anecdotally, I understand from the media myself, from news that some of the international airports in the country have developed screening mechanisms for folks traveling in and out of the country from some of those affected areas. But locally, there's nothing currently occurring.
And actually, Ebola really is an emerging infectious disease. It was first discovered in the Republic of Congo in 1976, and it has really been contained in small African villages until this past spring. So up until March, there were approximately 2,000 cases in West Africa since 1976. So now we're seeing something different as it's evolving into other parts of West Africa and seeing patients in other parts of the world now exposed to it. So it is new in many ways, and still trying to determine the complete epidemiology of this particular virus. Obviously, prevention is the key. I think our healthcare system is superb and can handle any types of patients. Obviously, that's not the case in Africa, and that's why we have seen the patient not survive there with high mortality rates. But their system is much different than ours. And so having that infrastructure to be able to provide the basic supportive therapies, if you will, while there is no treatment at this point, the supportive therapies, including the fluids, assisting with blood pressure problems, and just assisting with those other types of illnesses, signs and symptoms that come with this particular disease. And we've obviously seen success with those patients in the United States who have been treated here after coming back from Africa. The CDC has the experts, the world experts, and working in coordination with the World Health Organization and the many ministries of health around the world. We still don't know. There'll be an investigation on that, but obviously there was a breakdown in the protective equipment that she was wearing for her to become infected. So more to come on that one as the investigators have time to review that case.